Now let's come to a very important part of peeling. What are your indications? Dyschronias, hyperpigmentation, post-acne, post-inflammatory, blotchy skin, patchy skin, patients with photodamage, photomelanosis, patients of melasma, those with freckles. Lentogens usually do not respond, but when they come with photodamage, they could overall lighten the skin. A very big indication for glycolic acid is acne. Another indication is very superficial scarring and very early pitting. You could also help dilated open pores when it's associated with seborrhea, and glycolic acids and peels. All peels are also good for fine lines, wrinkles and rhytides. It's very important for us to understand the contraindications that we must be aware of before we embark on doing a chemical peel, whichever peeling agent you may use in your patient. Very important is ask for any active infection on the skin that you are going to treat. It may be bacterial, it may be viral such as herpes orolabialis. There may be some excoriated open wounds. These must be effectively treated. Prophylaxis for HSV must be given before you embark on and proceed to do a peel. So you may have to send your patient back, treat this for 3 to 5 days and then recall or bring them back into your clinic. It's very important to take a history of atopy in your patients, because if they have an existing atopic dermatitis or they have very atopic skins, they may actually end up with a severe inflammatory process few days or right after the peel, which then would take away from the peeling effect and require acute management for it. Also look out for any signs of seborrheic dermatitis along the hairline, in the eyebrow area, along the alae nasi, because these are areas that may also pick up the peel much more and must be well under control, and these areas should actually be avoided. It's important also to have taken a history of any drug, recent or chronic drug intake, especially those with photosensitizing potentials. Especially if a patient is on oral isotretinoin, you must be careful about doing a chemical peel. It's not that you cannot do a chemical peel with a patient who's on oral isotretinoin, but you may keep your strengths lower at about 20 or 35%, and it's preferable to do chemical peels such as glycolic acid in a patient who's on oral isotretinoin, who's on a lower dose like 20 milligram. I definitely would not agree to do a chemical peel with salicylic acid, trichloroacetic acid, Jessner's or any of the other peels in a patient on oral isotretinoin. I would refuse to do a peel. It's too risky. The skin is also already very dry and the patient may potentially have untoward side effect or overreact. The other important consideration is that you must keep in mind whether your patient is a compliant patient, has realistic expectations and is already aware and is following sun protection with the sunscreen with a good SPF and knows how much to apply and that they must reapply the sunscreen. If a patient is not using a sunscreen and is careless about using the sunscreen and has an outdoor kind of job, you should be very, very careful about doing chemical peels.